Okay, everyone, thank you for hanging on with us. This is the third panel, and today we're going to be covering the topic of education, healthcare, and technology. And to be honest, I have a confession to make. I've prepared notes. I've spoken to the panelists before, and I've had this perfect script that I had in my mind that I wanted to sort of bring it out to the table. But after what I listened, after listening to His Excellency Abdulla Luta's opening remarks, and how he pointed out that when he gave the example, if you want to tackle poverty, for example, you really also need to tackle education, healthcare, and so many different, areas and elements around it. And he referred to the nexus model that is part of, I would say, one of the best things that actually came out of the Global Councils on SDGs. And the fact that we have a panel today, all of you, I would say, represent nexus councils, councils of nexus models, is a very interesting sort of position, because you are leading amazing projects that are driving very high impact, and I cannot think that being a nexus model is a coincidence. This comprehensive sort of collaborative approach, I think, is the future of the SDGs. I don't know, that's so I wanted to open with that sort of, epiphany or observation that just happened after listening to His Excellency at the moment, and give you the opportunity to tell me, has that did actually being part of a nexus, sort of a kind of format, contribute to those great things that we're going to hear about today? And I would like to start with you, Dr. Judy. I mean, you started with the Global Councils on the SDGs all the way from the beginning. You chaired the Council on SDG 3, yes, and you're still very heavily involved with the current cohort, and yes, you interact almost with everyone around, not just here on the platform, I would say, even in the room. So did it actually make a difference that there is now a forum where so many different council members work together, whether within the council or outside of it?
Thank you for saying that so much, Samir. Very much what's happening now is that the councils are coming together to work together. And it is the spirit, and thanks to UAE that this is happening. I brought this because this was the symbol in the very beginning of the UAE's SDGs
okay,
in action.
I know what is this, but just for those who...
This is the symbol, this is a light bulb, okay, which is for innovation, indeed. And here are the symbols of all the SDGs, right, working together. So this was the brilliance of the UAE SDGs in Action councils from the beginning. And it so happened that our SDG 3 won the award. There was a competition, right, and actually Sharia Khalid was my partner in this, and we came up with this innovation called Health in Your Hands. Okay. That innovation is a platform of projects that are being done around the world, brilliant projects that are attempting to reach those furthest behind, which is what we want to do, and to achieve all the SDGs, 1 and 4 and 16 and 8, all of them together. And they're brilliant. For example, they are multi-stakeholder projects. One of my favorites brings together government, Mozambique and DRC, if you think about it, in Africa, and private sector drones. So, and the civil society people on the ground, because we need people on the ground who are actually doing something, and people to people, no matter what happens with this brilliant technology that we have, which I can talk about in a minute. So the drones are up there, and they're picking up all the health information, and they're downloading it to the people, and the people are working then, the government supporting this, to then go into the community as community health workers. Use that private sector drone information and deal with the real people, because we know, I'm a psychologist, we know from all the research that people to people is what really matters. We can have all kinds of technology, and we do, and there's plenty of wonderful ways that that's being really implemented now after COVID, but people want people. That's what makes them feel connected and get mentally as well as physically healthy.
Brilliant. Thank you so much for that. I want to move to you, Dr. Manal.
Thank you for asking me that.
You're most welcome. Because more or less you're in the same sort of domain or space, healthcare, and through Dubai Noor, you've spearheaded a number of amazing, impactful initiatives, and the last one, which I know is the Katsina project in Nigeria. Do you think that working again in that nexus model sort of methodology or approach played a role in what you have managed to achieve until now?
Yes, thank you for asking that. Actually, the Katsina program, and if you're wondering what Katsina is, it's a state in the northern part of Nigeria. And the Katsina program is a great example of the success of the Nexus model when it comes to targeting multiple SDGs. And we've had the privilege to work in partnership with the government in Nigeria and as well the government in the state of Katsina to roll out a program that specifically fights blindness and visual impairment. We managed in the past 3 years, working with academic experts and specialists, to measure the impact of the work that has been done on multiple SDGs. Now, one would assume that when it comes to preventing blindness, the major impact would be on SDG 3, which it was. It was the direct impact. We're so happy to say that we've managed to not only treat thousands of people, but we've also managed to build a sustainable model for accessing eye care and for people to know where to go when they have an eye problem, and to have it delivered to them wherever they are and without any delay. But we've also managed to impact, for example, SDG 1, no poverty. And when we first started, we did a survey, a simple survey to measure the baseline, and we found out that among the targeted population where we've worked, 96% were living under the UN Poverty Index. That is like $2 per day. And we set a target for ourselves. If we're going to work there for 4 years or for 3 years, the least we can do is reduce that percentage to, let's say, 50%. Sounded very ambitious at the beginning. But by the end of the 3rd year, we did a second survey, and we were surprised to know that the percentage dropped to 21%. Now, that's a difference of 75% of people that are no longer living under the poverty line. For some people, that might sound simple, that might sound achievable, but trust me, when you work in a place where they rely on each other, the people rely on families, on neighbors, on friends to get things done, and that's the culture where we've worked. So when I say that, I mean, like, if there was one person with a disability, specifically visual impairment, another person from his family has to stay behind and to take care of him. That person is usually a child or a woman. And so you can only imagine the productivity of the family and then the productivity of the village or the neighborhood dropping simply because there are too many people just sitting at home. And we managed to demonstrate that in numbers. For example, when we look at SDG 5, we made sure, with the support of the government, whom I'm very thankful for, whether it was the Nigerian federal government or the state of Katsina, to maintain the gender equality or gender balance in all the work we do. So we tried so hard to have equal rights for accessibility, and we achieved that by a little bit more than 50%, not only when it came to delivering healthcare to people who are in need, but also allowing the experts and the specialists to have equal rights when it came to pursuing an education in eye care or getting the training that they need in eye care. And that wouldn't have been possible without the support of the government, because most of the physicians and the paramedics and the nurses that we hired in our program were on the payroll of the Katsina government. And we managed to do that because that was a very good reason for it to be sustainable. If they're going to fund their own people and their own expert, then they will make sure that it continues, and it did. Then when we tried to measure the impact on SDG 3 itself, the best way to measure that, and I've been asked this question many times, every time I talk about the percentage, which are numbers, I'm usually asked, how did you measure that? Because there's specific numbers, and the answer is just talk to the people. Talk to the people. They'll tell you how they feel. They'll tell you how all this has impacted their lives. So
people don't want statistics. They want stories.
Exactly. And those stories can be translated and analyzed into statistics, because at the end of the day, you need your statistics to report and to convince other people to do the same. So we have managed to increase the productivity, the individual productivity, by 97%. We have managed to increase the income and the employment opportunities by 89%. And we have actually decreased discrimination by 90%, and with that we increased dignity by 90%.
By the empowerment
exactly.
Criteria that you
Exactly.
Yes.
Thank you.
Beautiful. Beautiful. I want to get back to you. There's something that has been on my mind since we started talking a few days ago. But before we do that, I want to come to you, Dr. Sonia. You lead the Abdulla Ghurair Foundation Education, and the way I see it, I think it goes way beyond education. Specifically in the latest project that I know of, which is the Nomo Initiative. Was that driven or inspired by the fact that you're part of, again, a council that encourages you working collaboratively with different council members covering different SDGs? Or is this something that is embedded in your mantra or your philosophy as the foundation?
I'll have to say the latter, because the reason why it is the way it is because we start with why we need to exist. And the fact is that we have an enormous youth bulge in this region and a very high unemployment rate. So the first thing that we did is we talked to the youth. My amazing team went to kind of the corners, all the corners of the UAE, and spoke to youth and asked, what do you want? What do you need? Because as was very, very explicitly stated in the panel before, it shouldn't be a bunch of people in an office making decisions for others. So we listened, and it came back very clear. Education for a certificate that led to no prospects of jobs was getting extremely frustrating for a number of young people. And what we wanted to do with the Nomu Initiative is reverse engineer it so that we could start building bridges and pathways. And you can't do that without multi-stakeholder partnerships. So that's where we started with SDG 17, which I have to admit I have a bias towards. It's my favorite. And so when we looked at it, we're like, okay, well, how do we do this? We need to talk to hiring partners and find out why is it? Because let's face it, the hiring partners have been complaining for a while that the graduates are not ready. The graduates are doing their job. They're going to school and they're trying their best. They're not hiding their skills. They're trying their best. So what was it that was going wrong in that transition period? And what we found was, in fact, there were small little doses of upskilling that needed to be happening. Rather it be in the digital upskilling space, or in the transition, what they call soft skills, or the transferable skills. And so how could we build programs that were more bite-sized and more digestible for different pathways? And so that's what we did with Nomu. And the first one that we launched exactly 1 year ago at the World Summit, the World Government Summit, was the Tech Up program. the Tech Up program.
Tech Up program.
And our partner on that is Udacity, alongside a bunch of hiring partners, including Mushroom Bank, who is our first official one to sign, to guarantee that the individuals who were going to graduate from this program would have a chance at either a paid internship, a job, a promotion, something, an interview. And so the idea was really to say, okay, what profile do you want? And we went to several hiring partners, and they told us, so those are the profiles that we're helping these young people build. And so that's SDG 4 for adults, if you will, and building into SDG 8, which is decent livelihoods, because that's what they want to have. They want to be self-sufficient. And so we did that with a number of other projects as well, including Siraj with CNN to build up those WEF 10 skills.
What are you specifically doing with CNN? Because I think it was brought up by the previous panelist, Dr. Yasser. We talked about the impact of press, because the press suddenly decided to talk about, oh God, the virtual elephant in the room, which is ChatGPT.
Yes.
Everyone was talking about it. And if you look at the past 2-3 years, I would say, the media industry has been under a lot of pressure. The whole narrative on fake news and newspapers are dying and all that. Why specifically? Why did you decide to work on that?
Siraj? Yeah. So our partner on this is CNN, and we did that specifically because CNN had a very big commitment towards looking at how to support young people in their storytelling. Mm-hmm. And I think that that's what it's about. And if you look at telling a story, it's just what you said, Dr. Manal, and yourself. It was, we need to talk to people and let them tell their own stories and find out from them. Only if you've never been taught how to critically think, how to analyze information, how to put it together, and how to communicate in a nice way that people can hear you, whether you're angry or whatever emotion you're feeling, the story doesn't come through. And what we wanted to do with these young people is allow them to have their own voice as opposed to using our voice to tell their stories. And so we've partnered with CNN to train them so that they can have their own storytelling capacity, in whatever capacity that they serve, whether that's at work or at home. There's this one very sweet young man who came to us after the program and said, I have never been able to explain to my family what I do for a living. And it has been extremely frustrating for me. And today I was able to tell them. And I know that sounds small, but imagine finally your community respecting you because they understand what you do. It really does bolden them. And so when you get emboldened, you get empowered, and then you can take that next step and help build the rest of your community.
It's a perfect segue, I think, to you, Clint, because one of the two things that His Excellency Luta said that you're going to know more about today. One is the report, the progress report on all the SDGs, and two, the story maps platform, which is running on an ESRI architecture. And if there is anyone that's literally working with each and every single council, it's you, because I don't know if the honorable audience has been to the website where you can see all the story maps and the progress of the councils, but it's a beautiful architecture. How do you, in a world where the attention is now becoming the most expensive commodity on the planet, in 2012 there was a research that calculated the average attention span of the average information consumer by 12 seconds, I think. They did that study again recently, and it was around 4 seconds. In a world where it's much shorter than a goldfish, if I'm not mistaken. In a world where we cannot focus long enough on something, how are you integrating that into this platform, into this design, where you want people to read more about what the councils are doing? I mean, you're the product design architect behind the story maps, if I'm not mistaken.
People on my team are.
Yeah, well, of course.
So there's one person who joined us from National Geographic, Alan Carroll. He, at the time, was the chief cartographer. He'd been at National Geographic for 25 years. Storytelling, that's a big tradition and an ethic built into that organization. And we all know and love them for what they do. He wanted to come to ESRI to build story maps, and Jack brought him in and called me in and said, "Clint, we're going to build story maps, and Alan's going to run it." And that's how it got started. But that, you know, your statement about that kind of level of connection that people make with story maps, and how much time do they spend? The average amount of time across story maps has always hovered over 10 minutes, 10 to 12 minutes. It's the power of storytelling, and what's interesting about storytelling with maps and all other multimedia, just imagine that's what you're doing, is creating stories. First of all, many people just get that bug about being an author and learning how to do that, and we were just shocked to see the development of it. In our community now, let's see, last year there were 377,000 story maps made. To date, there's over 2 million story maps that have been published out on the web. So everybody has a story to tell, and when they found this tool, they learned how to do it.
This is brilliant, and I mean, from a guy who spent 25 years of his career, more than half of it working for tech companies, and part of it working, for government entities. The first question that hit me when I saw the story map proposition on a geospatial sort of a services or product platform. I mean, what does this have to do with the stories? And then it just hit me. When we were young, when we were kids, if someone, if my mom and my dad wants to tell me a story, what's the first thing that they say? Once upon a time, in a kingdom far, far away. So it is space, time and location. Because if you don't have this geographical reference of where that story is happening, it's not going to stick. It's not going to be a story. So I think this is where the brilliance is that people are making a very solid connection of what you're doing, for example, in Nigeria, and seeing the topography and seeing images of that community. Plus,
every goal, there are stories to tell.
Brilliant.
And
I wanted to jump in here to what you were saying, that reference to what the ambassador said, His Excellency Lutfa, when he asked that we are behind in the SDGs, and yet for SDG 3, we're very proud that we've accelerated. Our story map has so much in it about what we've achieved, that in terms of what's been told here about financing, we're working with the Finance Advisory Board to build our innovations that are on the platform, that we're working with Noor, that we have so many different projects that we're working with. We have a working group that is looking at what are the barriers to scaling the innovations that you were talking about, the barriers to scaling them from regulation, from policy, from financing. And on top of all of that, we're dealing with something I know you'll ask about later, about climate change and health and how they interact. And the other major step we've made is a huge volume that is about resilient health systems, leveraging technology that everybody's talking about, and social innovation for the post-COVID-19 recovery and beyond, with tremendous, with chapters that are about government, that are about the role of civil society, the role of the private sector, and innovations for those groups and populations left behind. Like, for example, indigenous people, we haven't talked about them. And yet there's VR, AV, all these kinds of artificial intelligence tools that are being used for indigenous people, like these goggles, where they can, young people who are not connected to their culture can put on the goggles and see the ancients from their culture talk about the nature, the ground, the spirit souls.
It's another form of storytelling. Instead of
Yes.
being written on caves, now it's being
Now it is
it's
there.
projected through.
Exactly, the
Absolutely.
story of their culture
Yeah.
and their ancestors.
Which brings a huge sort of big thick red line on the notion of awareness and communication, because the whole idea of getting people to act, we are in the decade of action after all, is for people to know, to understand. And not only that, but to remember, for things to stick in their heads. And this is where the power of storytelling, comes in.
Brilliant.
But again, I want to go back to you, Dr. Manal, on something that has been kind of keeping me up at night for the past 2 nights. Why visual impairment? Why this disability in particular? Because we have a lot of problems, to be honest, and But why blindness? Why cure blindness as a solution to alleviate sustainability?
Well, this question has been asked several times today, and to summarize, the reason why His Highness Sheikh Mohammed bin Rashid was interested in fighting blindness globally is the impact that blindness as a disability has, not just on an individual, but on the community and the economics of that country. So at the 75th session of the United Nations Accelerating Actions for SDG, it was recognized that eye care or eye care services play an important role on and have a great impact on SDG 3 and the universal health coverage, as it has a very high mortality rate, and it impacts also mental health and well-being. But why does it do that? Because if you look at, again, going back to the numbers and storytelling, if you look at the numbers, it is known from our statistics that every 5 minutes a person goes blind. And
I need to stop. Every 5 minutes?
A person goes blind.
Around the world.
Yes, and how many minutes or how many 5 minutes has passed since we sat in this panel, and how many people turned blind unnecessarily? And also we know from our statistics that 80% of blindness is treatable and could have been prevented. And we also know the impact that a disability, whether blindness or other disabilities, has on the lifestyle, on the psychological, mental health of people, and also on the economy. And treating blindness is not expensive and it's not difficult. It can be achieved. And that's why eye care has been recognized as an important indicator when we are trying to achieve goals within SDG 3. Not only that, the United Nations have went far enough to identifying 2 specific KPIs that are related to the most prevalent causes of blindness, which are cataract and refractive errors. And these are the KPIs that we measure in nearly all our programs. And reporting the numbers or reporting the impact that our programs have on the KPIs and on SDG will not only give us a heads up on what should we plan next, but it will also encourage other governments to actually take in those programs or adapt those programs within their healthcare systems. And
specifically on that point, that you mentioned earlier, I want to stop at, which is the gender parity, because it was obvious that you've put a lot of focus on providing equal, non-discriminatory sort of kind of access to that bit.
Yes, when it comes to gender inequality in accessing healthcare, because we travel around the world to implement such programs, we found out that in different cultures, the reasons are different, but the end result is the same. Women are always left behind. Now, we couldn't change the culture of a country, or you cannot change the culture that fast. But what we did is we worked together with the governments and with other NGOs, local NGOs in those countries, to actually convince them and to showcase the importance of providing women with equal rights to access healthcare. I mean, we're providing the healthcare free of charge, but they still don't come for many reasons, many reasons. And they're different from one culture to another, from one country to another. But countries like the countries we work in, for example, Nigeria and Bangladesh, they have a high respect for women, especially women who are at home taking care of children, taking care of families, and women who are also working and providing support for their families. It wasn't very difficult to achieve gender equality, but I have to say it's not as easy as achieving it in those countries as in other countries.
Right. Dr. Sonia, I remember one of the initiatives under the NAMU project. Am I using the right terminology?
Yes, it means growth in Arabic. Right. It means growth in Arabic. Okay. It's an Arabic word.
You tech up
Siraj and Project Hama.
Project Hama. Project Hama is the one that tackles with female
military recruits in the country. It's a Prime Minister's office program, and we were invited to be a part of it.
Okay.
Yeah.
And was that driven by the fact that you want to also tackle that SDG specific on?
SDG 5 is so embedded that we forget to mention it. Everything we do at the foundation has a gender parity piece to it. We want gender balance. But one of the things that I think, even with Tech Up, what we did was, it was probably our first connection with another SDG council. Mm-hmm. We signed an MOU with Her Excellency Manal Mari for SDG 5. She holds that council to make sure that we were absolutely always focused on it in a very public way as well as in a private way. But it's something that for us, if it's like what was said before, you can't ignore half your population and expect to have economic development and expect, to have an educated class who are mostly the caregivers, raising the next generation without having all of those tools at their fingertips. And so it's very important to us.
Understood. Okay, so like all the other panels before, they did two things. Everyone talked about ChatGPT. Okay, and we're not going to do that, I promise. Yet I cannot resist the fact that 2 weeks ago, unless you're living under a rock somewhere, there are certain education bodies in the United States that is actually banning ChatGPT. Yes. They're seeing it as a threat, and it's just I don't know. It just hit me, and it reminded me of those days in the early '90s where the internet was banned in the workplace. I don't know if there are people old enough in this room to remember as I am. Are we going through that phase right now? Because, by the way, you guys in the healthcare aren't off the hook as well, because ChatGPT also passed the U.S. medical license exam, by the way, two weeks ago. Yeah. So how are we seeing it? Is it a friend or is it a foe?
Well, I think it's an opportunity. Okay. And it all depends on how you use that opportunity, because 2 days ago I read that it also provides AI-enabled symptom checker. And it won't only tell you what you have, it will also tell you where you should go and what service are you going to receive. And in countries or in places where accessibility is limited to healthcare, I think that will be a great tool for the people. So actually, for me as a physician, it is an opportunity. We also heard that in the UAE, a committee has been put together to regulate. Yeah, right. And I think that's very important, because me as a physician, understanding how it works and knowing how to deal with it is different than another person who might not be very familiar with how it works. And having regulation does not restrict its use, but it empowers the people to use it in a better way.
100%. Clint, do we expect AI-supported or AI-embedded geospatial sort of products?
Well, it's already there. So there's a number of image classification capabilities that are running on machine learning. There's a number of many analytical models and statistical models are doing machine learning, and the same is true in geospatial. It's just geospatial is another kind of aspect of those systems. So yeah, I think that's gonna continue to grow. There will be limitations. I think one of the big challenges that we worry about is the potential bias that slips in. It's really the data that can be accessed for this, and if it's data about kind of one class of people that look like me and not like some of you in the room, you know, that's something that I think we really take on as a challenge that needs to be addressed, and I think that that just speaks to the limitations for the technology.
Right.
I think everyone's interested in the ethics of what's going to happen with regard to technology and how we apply it and to whom and what are the regulations. I was so impressed when you were talking about mental health, because certainly the SDG 3 has target 3.4 about mental health, promoting mental health and well-being. The universal health coverage, which we'll be reviewing in September at the UN in the General Assembly, has mental health as a part of health. The key is really that everything in terms of whatever we could think about, poverty, work, SDG 8, preservation of the environment, it all has to really get down to, do we feel good about ourselves, to then feel good about our relationships, and then our relationship to the planet. So at SDG 3, we very much care about the equality of mental health with health itself, physical health. And WHO stands for that a great deal in its constitution.
COP28,
yes,
our most significant,
here,
most important, most anticipated event that's coming up here in the UAE.
Yes.
How do you see the road to COP28 through your council? And I give you each 1 minute because Chris is going to kill me.
Okay, our council is planning to do an event about the intersection between health, which is so clear, and climate change.
Okay.
And certainly, we know in my last 30 seconds that probably everybody here has something about climate anxiety or climate stress. Yeah. They may live in a country that is sinking, that they will have no country. There will be a climate refugee.
The SIDS, for example.
This is where we're facing.
Okay.
I'm sorry I get so passionate about this.
No. It's beautiful.
Well, when it comes to fighting diseases, one of the diseases, the neglected tropical diseases, and we've invested a lot of effort, time, and money, funding in fighting trachoma in a specific country. And we were looking at the results, and we found out that after 8 years of hard work, we're still at the same point. We haven't even reached, we're not even close to eradication or control. Wow. And one of the NGOs, our partners, called for an urgent meeting, and everyone should be there, the government should be there, and how can we, fuel it up with more funding and do this and do that. And we actually forgot the fact that this specific neglected tropical disease, or this specific contagious disease, has a vector, which is the fly, and the fly has a life cycle, and the life cycle is impacted by climate change. And if we look closer into that impact, maybe we can prevent the fly from spreading the disease rather than trying to just give more and more antibiotics to people. Yep. And that's when the idea of us partnering with ESRI for the GIS-enabled mapping of our efforts in fighting that disease comes in. And we're looking forward to starting that partnership and actually mapping not just the efforts of what we're doing on ground, but also mapping the life cycle of that fly that's spreading the disease, and looking at how environmental changes and climate changes, humidity, dryness, droughts and everything else is actually impacting the spread of that disease.
I can't wait to see this on Netflix.
Thank you.
Dr. Sonia.
Well, I think one of the things that and probably why I work in education is whether it's about carbon capture that Dr. Yasser talked about, or energy management, or the fly, or any of those pieces that I hope to see at COP28, because everything's implicated. Absolutely nothing will be done if we do not have an educated population either innovating or using the innovations or understanding the digital technology to be able to apply whatever it is that we need them to apply. And we need to do this in an equitable way, especially given, the skills gap and the digital gap. So I'm very excited about seeing education being embedded in COP28 because that's really a foundational piece.
Clint, are we going to see you again during COP28?
Probably. There'll definitely be people from ESRI, but the GIS is a really essential tool in this initiative, in this crisis. We've been looking at data. I can just tell you that over the next number of months and years, the news that's going to come out is going to be shockingly bad. We've seen some early kind of forecasts of what's going to happen. We're in trouble. And so for me, a big thing is, what do we do to create the next generation? Like, we need to do something for our children and students that are coming up. So we're hard at work on building lessons for that, and hard at work on, I just call it geo-accounting, finding ways to kind of roll up information in all parts of the world that can do reporting on all kinds of indicators that relate to climate.
Thank you so much. We're out of time. Ladies and gentlemen, please join me in thanking the panelists on their beautiful contribution, for their stories, their insight. Thank you so much. Thank you.